Namaste, and welcome to an exclusive Facebook Live session. Women go through a magnificent and transformative journey throughout their pregnancy to bring a new life into this world. Different stages of pregnancy, from conception to delivery, are special both for the mother and the baby. And to ensure you receive good maternity care throughout your pregnancy journey, healthy eating and supplements are very important. We are going to be discussing this crucial topic of healthy eating and vitamin supplements during pregnancy with our expert, Dr. Asha Devi, consultant obstetrician and gynecologist at Apollo Speciality Hospitals, OMR. With her wealth of knowledge and expertise, she'll be guiding us through this discussion and addressing all your queries and concerns. So, what's waiting? Let's start.
Hi, thank you for having me here today. I feel really happy to connect with you all today to talk about an important topic, healthy eating and supplements in pregnancy.
Thank you for the introduction, Doctor. So, why is nutrition important during pregnancy and how is it important both for the mother and the baby?
Before I answer this question, let me ask you one simple question. Have you heard of this terminology called hidden hunger? So, hidden hunger has created a real global burden. And of course, in India, we have seen that it has gone into a perfect strike of the core of our health without surfacing at all. So, what is this hidden hunger? When your diet lacks the perfect combination of balance of key nutrients, you develop micronutrient deficiencies in a wide range, including iron deficiency anemia, vitamin D deficiency, folic acid deficiency, low birth weight babies. And this directly affects two primary sources of our country, women and children. So that is why so much of emphasis is being given on healthy eating and nutrition in pregnancy.
So, while talking about healthy nutrition, Doctor, what are the key nutrients that expecting mothers should focus on incorporating into their diets, as well as which helps the babies as well?
Yeah, when we talk about the key nutrients in pregnancy, we have a big list. Importantly, starting from folic acid, iron, vitamin D, choline, calcium, potassium, and fibers. All these are important for the proper neurological development of the baby and also total well-being of the mother as well.
In that case, Doctor, when we talk about holistic health development both for the mother and baby, what should be the aim for a healthy eating during pregnancy?
Yeah. So when we look at what should be a aim on a balanced diet, so generally we can divide the food into 5 categories: fruits, vegetables, dairy products, grains, nuts and seeds. So whenever you are looking at your palate during pregnancy, ensure that all these 5 portions are there in every meal. So, and the key challenge here is encompassing the key nutrients in the diet and parallelly balancing a healthy weight gain. So this is what you need to look for, and this is what you need to discuss with your doctor when you're looking at diet in pregnancy.
And this happens, or this is supposed to be followed through all the trimesters?
Yeah. See, there can be mild variations because what generally happens is when a girl gets pregnant, most of the girls start facing this excessive vomitings and tiredness. So even if they have the aim of, taking the target nutrients, what they wish to have, the body might not accept that. So there is a possibility that they may have to go on some compromises in the first 3 months. So, and we always reassure the patient stating that when there is a mind breach in, only including key nutrients in the first 3 months, don't worry, the baby still grows healthy. There shouldn't be a problem as much as you take the supplements properly. When they complete the 12 weeks and start entering the 13th week, that is when they start getting better with the vomitings. And that's when we focus more on the key nutrients. That is, we go into the proper advices, the proper amount of calories and all that. And now again, when we talk about how much quantity to eat, so there has been this folklore stating that eating for two is the concept when it comes to pregnancy. But that is not right. The quantity of food is going to remain the same in the first 6 months. As the pregnancy advances, From the 7th month onwards, it is just 300 to 400 kilocalories per day extra which is needed. So don't always focus on the quantity, it is the quality of food which actually matters in pregnancy.
So that said, doctor, pregnancy is also an entire journey of cravings for mothers. So, what happens when a mother craves every time? And there's obviously it's followed by weight gain as well. So, how do we manage cravings?
So when you mentioned about these cravings, I can specifically talk about the sugar cravings which we see in the pregnant mothers. Of course, I don't tell them strict no for sugars. So once in a while you're having sweets, if you're not having a diabetes or high sugar profile, that is fine. But when you are thinking about alternatives, healthy alternatives during your sugar cravings, I would obviously recommend fruits. So the fruits are the best alternatives, and when we go on with fruits, I would encourage you to have whole fruits instead of fruit juices, because that way you can balance your weight gain. Compared to fruits, fruit juices can give you more calorie addition, which in turn can put you on a more weight gain in pregnancy.
But what about all the pani puri addictions, doctor?
Yeah.
What do we do with these cravings, and how do we ensure that our daily nutrients are also met?
So, handling cravings, like, when you have this interesting chat or the Chinese type of food, I always tell my patients break that cycle by having it once. So, but it should not become a routine. So, you cannot obviously have it on a day to day basis. Only that if you're having once in a week or once in 2 weeks, it is absolutely fine. So, when you go in for chat, I would always say that because generally chat is prepared without, the need of fire, there is a possibility that you can get infection from it, especially the water contamination. So please ensure that you get it from a hygienic place. And whenever you are sorting to outside food, ensure that it is always well cooked so that there is no bacterial contamination. And please don't have stored food when you purchase it from outside, because that can increase your chances of bowel indigestion and also infection.
Doctor, speaking of weight gain, what amount of weight gain is typically considered normal or ideal during pregnancy?
Yeah, this is something really important every pregnant mother should be knowing. So, weight gain varies from one pregnant mother to another. Basically, because we ideally recommend weight gain for a mother based on her BMI. So, and what is this BMI? BMI is nothing but the height versus weight ratio. So, if a pregnant mother has started off with a BMI of 19 to 23, which we call ideal for the pregnancy, then going up to 11 to 15 kg all through the pregnancy is absolutely fine. So if a mother comes to us with a BMI of 23 to 25, then we generally recommend weight gain of up to 10 kilos the whole pregnancy. And if we see a mother more than 25 with a BMI, then the recommended weight gain is between 5 to 7 kgs all through her pregnancy. Definitely, she needs to be monitored all through so that she doesn't gain extra weight, which can hamper the way the labor progress can go.
Which stresses the importance on routine physical tests and screening to keep an eye on the mother's health as well as development of the unborn child, right? So, doctor, coming to another crucial aspect of today's discussion, which is supplements. What are supplements in the first place? Vitamin supplements, as they call it in the world outside. What are supplements, and how is it very essential during pregnancy, doctor?
So, I can define supplements. Basically, what supplements are is, if you think your diet is not going to give you enough of the key nutrients to your body, then we look upon supplements. So, pregnancy is a very demanding phase both for the mother and the baby. So, as the pregnancy advances, the mother will be needing more amount of the key nutrients for herself and also for the different development process of the baby. And when we look at the key supplements in pregnancy, it starts from folic acid in the first 3 months. Then you'll have to start iron and calcium. Of course, in India, we see a rampant iron deficiency up to 15 to 90%. So it is really important that every pregnant mother starts having iron right from the 3rd month. Along with that, calcium supplements. So per day requirement of calcium for any pregnant mother is 1000 grams, 1000 mg, which means that she has to start taking calcium from the 3rd month itself. And now the new addition is vitamin D. We do see vitamin D deficiency as high as 84% in pregnant mothers. And when I talk about supplements, another question which comes from most of the mothers is, Doctor, why do I need to take it? I'm having good balanced diet. Isn't not enough? So I have explanations for each of these. So first talking about folic acid. So what happens when you try taking folic acid only from the diet? So there is possibility that your folic acid can partially get destroyed during cooking the process. So and that can put you at a lower levels for the developing baby, and which is very crucial for the baby's development of brain and the nervous system. Coming to iron. So generally what happens is during pregnancy, your body tries to hold up some amount of water. This is a compensatory mechanism because every mother has a possibility of during a bleeding during the delivery process. So during that time, in order to accommodate the blood loss, you tend to collect more water during the whole pregnancy journey. So when this happens, there is a possibility of dilution of blood happening. And this can put in a small drop in your hemoglobin levels. And as I already mentioned, Indian women have an inherent chance of having anemia, nutritional deficiency. So it is very important that you take the iron supplements and keep your hemoglobin level balanced so that you are able to accommodate yourself during the labor process. Coming to calcium. So the body has enough calcium when you're out of pregnancy. But when it comes to pregnancy, the baby derives all the calcium from your bones. So, and this can make your bones really weak. You might not be noticing them during the pregnancy process, but what can happen is post delivery, you can start experiencing severe bone pain, back pain, heel pain. That is why we always encourage all pregnant mothers to stay always in a regular basis, take the supplements of calcium. Coming to vitamin D. Of course, vitamin D is newly spoken of these days. And like I said, see, we live in a country like India where, in Chennai, obviously we are having good summers. But still, we do see that 80% of Indian pregnant mothers are vitamin D deficient. And when you put a mother not on enough supplements during the pregnancy, we have seen children born later having bone problems like osteomalacia and rickets. So it's really important that you take the right amount of vitamin D supplements during the pregnancy phase itself.
Are there natural sources of getting these supplements, doctor? Like vitamin D, you can always go out in the sun during an optimal hour. Are there any natural sources as well?
Yeah, we do have natural sources, but I can tell you what are these. So you can get vitamin D through dairy products, you can get them through eggs, fishes, mushrooms, and of course, having yourself exposed to the sun for at least half an hour, probably in the daytime. But that alone wouldn't be sufficient if you screened your vitamin D levels in blood and you are found to be deficient. If you have a deficient level, it is very important to replenish your stores, something like your savings in the bank. First, you'll have to replenish your stores, and then you can think about maintenance of the vitamin D levels through the diet pattern. So this is generally a common question when we give them vitamin D supplements. Now, pregnant mothers ask us, Doctor, just tell me some dietary items. I'll try pushing it with diet alone. Wouldn't be sufficient at all because replenishment of the stores is really important, and that can be achieved only through medications, that is, external tablets.
Doctor, we speak very commonly about omega 3 fatty acids for pregnant women and how beneficial are they?
Yeah, omega-3 fatty acid is really important for the developing baby, especially for the nervous system and the brain development. And we do have rich sources of omega-3 fatty acids in the diet itself. First, fishes. Especially when you're choosing upon fishes, be little careful because nowadays we see a lot of mercury contamination in fishes. So low mercury fishes are the ones which you should go for. That is one thing. Apart from that, if you are looking for vegetarian sources of omega-3 fatty acids, you can go for walnuts, chia seeds, broccoli. All these generally can give you good portions. There is no need to directly going for a supplement for omega-3 fatty acid, but if you're maintaining them on a regular basis on diet, that should suffice.
Uh, Probiotics, doctor, a next well spoken and mostly widely spoken about topic. What are the benefits of incorporating probiotics in our diet during pregnancy?
Yeah, so what happens is in pregnancy, what happens to the digestive system? The whole digestive system slows down. And generally, what happens, you can develop indigestion or some type of constipation, or some people will develop easy food poisoning. So it is very, very important that you get restored with probiotics. And another important reason is in pregnancy, you have a chance of developing vaginal infections more commonly because your immune system goes a little low. So ensuring yourself with good probiotics will make sure that the good bacteria which are required for the proper protection of your body is being maintained in limits. So for your preventing vaginal infections and also gut infection, probiotics play a major role.
Doctor, with the pregnancy progressing every month, the need to visit the washroom or the toilet becomes more often for women. Uh, Hydration becomes a very crucial aspect during pregnancy. Can you discuss the importance of hydration during pregnancy and how much one should aim to drink water? How much quantity is ideal during pregnancy?
So, hydration is something really, really important in pregnancy, especially in the first 3 months, because we do see a lot of vomiting episodes in pregnant mothers. So, in the first 3 months, what happens is if you're constantly vomiting, your water loss happens in the body. That can alter the salt levels in your body and put you at various other risks. So, ensuring that you take at least 3 to 3.5 liters of water per day is very important. And if in case you are not very much interested in having plain water, like I always tell my patients, you can try infuser bottles just to change the flavor of water, especially in the first 3 months. That can help you a bit in encouraging yourself to get hydrated. And of course, down the line, also hydration plays a very major role because pregnancy, as such, is a process of dehydration in your body because your body is constantly working to support your developing baby. So always ensure that you manage drinking enough water in pregnancy.
Doctor, how does gestational diabetes impact the dietary recommendations that you provide to your patients?
Yeah. So what is gestational diabetes? When you newly develop high sugar values in the middle part of pregnancy, we call it gestational diabetes. So when I say that you have developed diabetes in pregnancy, the first question I've been asked is, Doctor, I take my food in the right portions. I don't eat any junk. I don't eat any chocolates, ice creams. But still, why is my sugars high? So diabetes in pregnancy is not only because of your dietary intake, but it is also because of the placenta, which can make your glucose levels not being maintained at the normal range. So when it comes to how to handle the diet recommendations, so the first thing is your carbohydrate levels should be low. Start including more protein. You can look in for millet options also. The next important thing is if you're going for the fruits, there are no major restrictions when it comes to fruits. But going in for whole fruits would be much better than going in for fruit juices. So if you've been told that you can engage in good physical activity every day by your doctor, then engaging in at least 30 minutes of physical exercises is important so that your sugar gets more under control.
Doctor, can you address some of the common misconception or myths that are about nutrition during pregnancy?
Yeah. So the first thing is eating for two. Is it really true that eating for two helps in pregnancy? Definitely no. If you are going to eat for two, of course, your weight gain is something which we need to look at. And as such, when we look at what is the quantity recommended in pregnancy, in the first 6 months, it is actually the same quantity which you've been having outside pregnancy. That much would suffice for the development of the baby. As the pregnancy advances, it is just that is from the 7th month onwards, it is just that 300 to 400 kilocalories per day, which is actually needed for the development of the baby. The second thing what we have commonly heard is, does taking ghee on an everyday basis favor normal delivery? So ghee is actually a good food which can help in healthy fatty acids, which will help in the baby's development. But again, if you're having ghee in large portions, it can increase your calorie levels, and that in turn can produce more weight gain to you. This, in fact, would hamper the normal delivery process. So, small portions of ghee every day would generally be good from the baby's development point of view, but not for the normal delivery. The third thing, what we've seen is, we see a lot of people have restrictions in having pineapple, jackfruits, mangoes. So can you have them in pregnancy?
And papayas as well.
Yeah, correct. Papayas. So if you're having them in small portions, say a small cup, say 100 grams, that is absolutely fine, but not like a huge fruit. So basically, moderation is the key behind this. In small portions, it's not going to harm you or the baby.
Doctor, coming to a next very crucial aspect during pregnancy, stress. Many women are working, handle their homes as well as are pregnant, and stress is inevitable today. How do, or rather, how does stress and mental health factors uh, impact pregnancy, and how can a pregnant woman support their mental well-being along with their nutrition, doctor?
Yeah. So rightly brought in the topic, stress is something which is like very commonly seen these days. So if any pregnant mother asks me, doctor, I feel so stressful in this whole pregnancy. So I generally ask her this, can you name one person whom you know who's not having stress? So every person, every human being is going through stress during their life. So it is only about what de-stressing measure you have adopted on a day-to-day basis. De-stressing measure can be anything. So if you are having a personal hobby, if you like doing physical activity, if you like going for a small outing, so any type of de-stressing measure on everyday basis actually helps.
And what if this de-stressing measure is binge eating?
Yeah, definitely not vegetarian. So what you can do is if you are interested in, going outside for a small, out like a walk, you can take your partner and go for a walk. Or if you are interested in some, craft activities, I know a lot of pregnant mothers start uh,
Knitting and
showing interest.
crochet.
Yeah, yeah. So craft activities actually help. So that's why in the past also, always knitting and the sweaters, they make sweaters and all. This is basically because they have to keep their mind very calm and cool. When you're engaging in something which interests you, automatically your happy hormones go a little higher. That reflects on your baby's well-being also. And importantly, take your partner's help or your family's help if you feel that your stress level is going beyond control. Or even you can talk to your colleagues that you're getting too stressed out. And of course, I'm sure that nobody is going to say, no, you have to do it. So everybody understands the situation of yours. So don't think that, you are alone in that particular situation.
We'll take some common questions from our viewers, doctor. My wife is experiencing morning sickness very frequently, and she's in her second month of pregnancy. What dietary adjustments or supplements do you recommend for her to manage this symptom during her pregnancy, and how can she enjoy this journey?
So when it comes to vomitings in pregnancy, it is something almost 7 to 8 in 10 pregnant mothers experience. So the interest in food first reduces. So what you have to start doing is instead of having 3 meals per day, split it up to have it as 5 or 6 times per day in smaller portions. That actually helps. And generally what we say is if you're not able to have solid food, you can always go in for alternatives like porridges, soups, or smoothies, which would be easily entering you without much of an effort. And like I mentioned, hydration is very important, but we see a lot of pregnant mothers in early pregnancies not able to drink water. In that situation, going in for alternatives like infusers or fruit juices to start with is always fine. But when you are preparing fruit juices, please ensure that that is immediately consumed and you don't put any bit of sugar or glucose in it.
Hi, doctor. I'm in my second trimester and have been feeling very fatigued lately. Are there any foods, specifics, or vitamins that I should focus on to boost my energy levels?
Yeah. So the whole pregnancy is a calorie burning process because what happens is you're constantly giving your energy to the developing baby. So what I would recommend is once you start entering the third, fourth month, it is very important that you start introducing a balanced diet. The first 3 months may have been little compromising for you because of vomiting. So ensuring good amounts of proteins, carbohydrates, and healthy fatty acids is really important, one thing. And if you're feeling really tired, it's important to screen yourself for hemoglobin and also your vitamin D levels. Because if those levels are less, it is very much possible that you can get easily tired. And when you go on for the external supplements, you may start getting better with these.
My sister is a vegetarian and is worried about getting enough protein during her pregnancy. What are the plant based protein sources you would suggest as an expert to incorporate into our diet?
Of course, yeah, non-vegetarians have a wide range of options when it comes to proteins, but vegetarians do have. So when it comes to plant-based protein sources, you can go in for all the dal varieties. They have good sources of proteins. And then you have the beans varieties, the kidney beans, the chickpeas, the green peas, the green beans. All these have good sources of protein. Nuts and seeds, they are also good in proteins. The only difference is that if you take 100 gram of meat, probably that gives you a good portion of protein for your body, but you might have to almost double it up when it comes to the vegetarian sources. You might have to take a little more to get the same amount of protein in your body.
Doctor, speaking of protein during pregnancy, doesn't it lead to a lot of flatulence or acidity if consumed in larger quantities?
Yeah, definitely yes. If you are constantly going into this protein based diet alone, you can develop problems because in pregnancy, what happens is the digestion system slows down. And generally, if you are more into carbohydrates, suddenly trying to increase your protein content, you can suddenly start feeling a difference in the way your digestion process works. So, introducing it step on step actually matters. And you have fruit sources of proteins as well. So most of the fruits are also rich in protein. So you can go for fruit alternatives, which reduces your digestion symptoms or the problems. So that would be better. Introducing them slow is really important.
My daughter has a history of food allergies and sensitivities. Uh, should I first discuss that with the gynecologist when she goes for her pregnancy checkup? And are there any precautions that she should take or specific foods that she should avoid during pregnancy?
So whenever it comes to food allergies and when a patient is meeting a doctor for that, so generally my opinion is actually the patient is the best person to know what food allergy she has. So instead of me telling that you avoid these, they themselves would be having a big list to state that, okay, these are the allergies I have. So whenever you have a wide range of food allergies, the first thing, avoid all the food items which you develop the mildest allergy because in pregnancy they can flare up more. Second, importantly, we have seen the seafood allergy happening to pregnant mothers who were outside pregnancy tolerating seafood very well. So generally, if you're going in for prawns or crabs, be sure that you have somebody around or some help around because we have seen allergies newly happening during pregnancy with seafood. That is really important.
I have been craving sweets constantly since I became pregnant. I was not like this before. How can I satisfy my cravings in a healthier way and still maintain a balanced diet?
So, yeah, pregnancy is a time where you can develop some weird cravings. So, some people can have cravings for sweets, some people for chat, or some people for outside food. So, when it comes to sweet cravings, so first thing is break the cycle. Don't keep longing for that for 2 weeks, 3 weeks altogether. First, have some sweet and break the cycle. So, and but this should not become your routine. So, having a sweet once a week or once in 2 weeks is absolutely fine, provided your sugar levels are normal. But when we talk about healthier alternatives for sweets, going in for whole fruits would help you to go in for a healthy alternative.
What would be your message to our viewers who are watching this session, doctor, especially mothers who are pregnant?
So, pregnancy is a thoroughly enjoyable phase. And when you are pregnant, it is not only about you, it is the whole family who's traveling with you all through. Of course, you will have external pressures from your parents, your grandparents that eat healthy, eat this, eat that. But at the end, the first thing, don't force yourself. Eat as much as you are able to have. Okay, it is still fine. If you are able to have them only in small portion, don't worry about the growth of the baby. Baby will be constantly growing, and we have special investigation process to keep checking you or keep a constant check on whether the baby is growing well. The second important thing, don't forget your supplements. If you are a person who doesn't remember things on time, please keep reminders because supplements are very essential to keep your baby grow in a healthy way. Third, importantly, if you feel really stressed out in pregnancy, please don't stop within yourself. Talk to your family, talk to your doctor, take help.
Thank you very much for a very insightful session on all we needed to know about food, vitamin supplements, the cravings, and the exercises, and everything that a woman needed to know during her pregnancy, doctor. For appointments with Dr. Asha Devi, consultant obstetrician and gynecologist at Apollo Speciality Hospitals, OMR, please contact 044 4040 1066. I repeat, 044 4040 1066. Thank you very much, Doctor, for your valuable time. Thank you, viewers.